Good morning, students. Today, we'll be dealing with the joints, which is part of the Module 1 General Anatomy. Learning objective is to understand the definition, classification of different types of joints. What are the joints? These are the places of the skeleton where, number one, two or more bones, or bones with cartilage articulate, or two or more cartilage articulate with each other, join with each other. They are supported by a variety of soft tissue structures. Articulation means joint, and arthology means study of joint. Classification of joints can be functional as well as structural. In the functional classification, it is based upon the degree of mobility of the joint. They can be immovable joints like the sutures, the slightly movable joints like the cartilaginous joints, and the freely movable joints, that is the synovial joints. The structural classification, it is based on the type of connective tissue and presence or absence of the joint cavity. Can be fibrous joints, cartilaginous joints, or synovial joints. The synovial joints are most commonly available in the human body. Now talking about the fibrous joints. These are bone-forming joints are united by fibrous tissues. Joints are either immovable or slightly movable. There is no joint cavity. There are three types: sutures, syndesmoses, and gomphoses. Now, what is sutures? They are immovable fibrous joints which are peculiar to skull only. They are band skull bones together by a thin layer of connective tissue. Based on shape of articular surface and margins of bones, sutures are of following types. One is the plain, serrated denticulate, squamous, synovial. Incidentally, they undergo synostosis, so skull of child is resilient to fractures while in adults. Now talking about plain suture, which is a part of a sutural joint. These are plain and smooth. Example, medial palatine suture as depicted in the picture. Serrated suture, they are serrated surface with interlocking. Example, the sagittal and the coronal suture. Denticulate suture, they are more interlocking like a tooth of a saw, like the lambdoid suture. Squamous suture, their surface flat and overlap each other. Example, the temporal and the parietal bone. The bend between the temporal and the parietal bone. Synovial, specialized ridge of one bone fit into the groove of another bone. Example, joint between rostrum of sphenoid and ala of femur. Syndesmoses is the second classification of fibrous. It has two bones bound by a greater amount of connective tissue. It has interosseous ligament and membrane. Most movable of fibrous tissue. Examples are middle radioulnar joint, middle tibiofibular joint, and inferior tibiofibular joint. Next comes the gomphoses. It is attachment of a tooth to its socket. It is held in place by fibrous periodontal ligament. Collagen fibers attached to jawbone. Some movement while chewing. Clinically, after some age, tooth become loose and may fall due to degenerative changes, inflammation of the periodontal ligament, which is there in the diagram. Then the cartilaginous joints. These are bones forming joints that are united either by hyaline or fibrocartilage, no joint cavity. These are of two types, primary as well as secondary. The primary are known as synchondrosis, secondary are known as symphysis. In synchondrosis, it is a joint between epiphysis and diaphysis. Example is first constrosternal joint. Whereas the secondary cartilaginous joint or the symphysis, the example is symphysis pubis or the intervertebral joint. Primary cartilaginous joint, these are bones forming joints are joined by plate or of hyaline cartilage. They are immovable and temporary in nature. After growth, they undergo fusion, that is synostosis. The cartilage is no more present. Secondary cartilaginous joint, bones joined by plate of hyaline cartilage which are connected by disc pad of fibrocartilage. They permit slight movement. They are permanent in nature, means remain in cartilage throughout the life. Next, the synovial joints. These are most common joints in which two bones are separated by a space called a joint cavity, covered by articular capsules. Synovial fluid in the cavity, most are freely movable. This is how they look like. They have a blood vessel, nerve, synovial membrane, fibrous capsule, fibrous layer, membranous layer, articular cartilage, tendon, bone connected to each one bone to the other. The characteristics feature of synovial joint. The articular surfaces are covered by thin plate or hard of hyaline cartilage. The cavity inside lined with synovial membrane, except over articular cartilages. Cavity filled with synovial fluid secreted by synovial membrane provide lubrication and nutrition. Sometimes additional features like articular disc, fat pads are also present. Now the composition of synovial joints: fibrous capsule, synovial membrane, articular cartilage, ligaments, articular disc, bursa, and fat pads. The articular capsule, it encloses the joint cavity. It is continuous with periosteum. It is lined by synovial membrane. Stabilizes joint in a way permit movement but resists dislocation. Synovial membrane, it is also commonly known as SM. The vascular membrane of connective tissue, it produces synovial fluid. SF is for synovial fluid for lubrication of joint. Now the synovial fluid is slippery fluid. It gives the nutrition to the cartilage. Articular cartilage is hyaline cartilage which covers the joint surfaces. Articular disc and menisci, it is fibrocartilaginous which is between bones of joint, jaw, wrist, sternoclavicular and knee joint. It absorbs shock, guides bone movement and distributes forces. Bursa. What is a bursa? It is a pouch-like sac which is filled with synovial fluid between the tendon and the bone. This is how diagram depicts about the synovial membrane, synovial fluid, tendon, muscle, fibrous joint capsule, hyaline cartilage and ligament. Now the clinical anatomy goes back to the osteoarthritis. Now what is post-osteoarthritis? It is damage to articular cartilage or reduction of synovial fluid which occurs due to friction between two bones increase and they begin to degenerate. Abnormal bone repair leads to uneven bone surfaces. It affects large weight-bearing joints like the knee joint. Formation of osteophytes. Now there is another kind of arthritis, which is a rheumatoid arthritis. It is an autoimmune disease of synovial membrane. Now classification of synovial joint is according to the shape of articular surfaces, according to the plane of movement, according to the number of articulating bones. According to the shape of the articular surfaces, it is the plane joint or the gliding joint. It is the simplest of all. It is a flat articular surfaces in which bones glide over each other, and it is limited. Only monoaxial movement is there. That this movement is only in one plane. Intercarpal or intertarsal are the example. Hinge joint, it is most common type of synovial joint. One bone with convex pulley shaped surface that fits into a concave depression on the other bone as it is depicted in the diagram. It is a monoaxial joint that the movement is unidirectional like a hinge of the door. Then the pivot joint, the example is superior radioulnar joint or the medial atlantoaxial joint. The one bone is rounded that fits into a ring-like concave part of another bone. Movement here is axial rotation around the central axis. Then the condylar joint, it is round articular surface of the bone which fits into the socket-type articular surface of other one. It is a biaxial joint, two direction, that is, it provides flexion, extension, and a limited rotation. The well-known example of condylar joint is knee joint. Then the ellipsoid joint, elliptical convex surface as depicted in the first picture of one bone articulate with concave elliptical surface of the other bone. It is biaxial joint, that is movement permitted only in two directions. Like the radiocarpal joint, it provides flexion extension as well as radial and ulnar deviation. Then the metacarpophalangeal joint and metatarsophalangeal joint. Next, the saddle joint, it is each articular surface is reciprocally shaped like a saddle, concave or convex. It is a modified condyloid joint. It is a biaxial joint, more movable than a condyloid or hinge joint. It forms the primate opposable thumb. The well-known example of this is first carpo-metacarpal joint. Ball and socket joint, most commonly present and helps in freely movement of the body. The examples are shoulder joint and hip joint. In the diagram, it is showing the hip joint, which is between the head of the femur and the acetobulum of hip bone. It is a rounded convex surface of one bone which fits into the cup-shaped depression of the other one. That is the convex surface, which is known as head. It provides greatest range of movement in all number of axes in all direction. Hip joint, shoulder joint are the example. This is an overview of all the joint. First is the ball and second joint. It is showing of the shoulder joint. That is, it is between head of the humerus and the scapula, the glenoid fossa of the scapula. The second example is regarding the hinge joint. Hinge joint is the humero-ulnar joint, which is between the humerus and the ulna, which becomes a part of the elbow complex. Third is the pivot joint, which is between ulna and the radius, which forms the superior radio-ulnar joint. The fourth in the picture is around gliding joint, that is the intercarpal joint, which is between the two carpals, which is also a plain synovial joint. Fifth is about saddle joint, that is the trapeziometacarpal joint or first carpo-metacarpal joint of the thumb. It is between metacarpal bone and the trapezoid carpal bone of the thumb. It's located near to the thumb. Next is the cordyloid joint or metacarpophalangeal joint. It is between the metacarpal bones and the phalanges. So it is metacarpophalangeal joint. Now, according to the planes of movements, movement in one plane, it occurs, the example is hinge joint, that is around the transverse axis. Then the pivot axis joint, that is vertical axis. Movement in all the joints, two planes, example is condylite joint, like the knee joint, then the ellipsoid joint and the saddle joint, like the first CMC joint. Movement in three axes, all types, that is the synovial joint, that is the ball and socket joint. According to the number of articulating bones, it is simple, compound, and complex. Simple, only two bones articulate, shoulder joint. Compound, two bones, more than two bones, like the elbow joint, wrist joint, and ankle joint. In complex, it is joint cavity is divided by disc or menisci. For example, temporomandibular joint and knee joint. What are the learning outcomes? The learning outcomes are to apply the concept of the definition, classification of different types of joints. Thank you.